Okay, so I'm doing a PowerPoint on the health concerns related to survivors of sexual assault. Um, so here's just a description of my population. So the population chosen is those who have been subjected to sexual assault. The National Sexual Violence Resource Center, or the NSRVC, states sexual violence happens in every community and affects people of all genders and ages. Sexual violence is any type of unwanted sexual contact. This includes words and actions of sexual nature against a person's will and without their consent. A person may use force, threats, manipulation, or coercion to commit sexual violence. And people of this population are far more common than we think. A very common group of people who unfortunately have to experience, or not don't have to, but happen to experience situations like this are females on college campuses. So some of the research articles that I found are specifically associated with those women who are on college campuses, unfortunately. So here's some information related to the size of the population. In 2019, Utah's rape rate was 56.8% per 100,000 adults. So this means that approximately 56 people per 100,000 adults were sexually assaulted in 2019. So compared to the United States as a whole, Utah had a higher sexual assault rate. For the U.S. itself, the rate was 42.6 per 100,000 adults. And then locally, Weber County was at 40.6% per 100,000. Davis County was 34.2 per 100,000. And Cache County was 40.6% per 100,000 adults. Contributing factors for this population. Here are some of the social determinants of health, and it seems that one of the big social determinants of health is lack of access to health care, and I'll kind of explain why. So Nelson et al. Discussed that survivors of sexual trafficking have a difficult time with healthcare. Some things that can prevent disclosure to healthcare providers are socioeconomic isolation, stigma, shame, guilt, fear of judgment, fear of retribution by traffickers, fear of law enforcement authorities, and other factors known to inhibit disclosure can exert a formative influence on survivors. Healthcare experiences, healthcare access, and health services engagement. So this article discusses how survivors have a lot of barriers to healthcare. Some of those are listed above, like I just mentioned, but Nelson et al. Discusses that there are three main profiles for survivors regarding healthcare. There's avoidant, distrustful, and constrained. So among those three profiles, all of them discussed a sense of disenfranchisement, basically feeling like they didn't have control or right. So Nelson et al. Continues saying that understanding that the feeling of disenfranchisement functions as a filter through which trafficking survivors perceive and experience medical care can help healthcare professionals take appropriate countermeasures. So healthcare providers must be aware of survivors and their struggles. The goal is to enable them to express their thoughts and feelings in situations. So sometimes these survivors feel a difficult time expressing their concerns and fears and their experiences to healthcare providers and law enforcement. So it's important that we do training and receive education on the importance of interacting with the people who have experienced these traumatic events. So here's some specific concerns related to this population. Carlucci M. et al. Discusses that PTSD is more prevalent in survivors of sexual assault, and he also mentions that traumatic events can cause neurological difficulties in recounting the events of experiences. So that can also contribute to issues related to seeking repercussions in court. So Carlucci et al. 2019 discussed other common issues among survivors. These include, but are not limited to, depression, anxiety, and substance abuse. He also mentions that there is a higher satisfaction with personnel assisting survivors. For survivors who interacted with all 5 groups of personnel, which include people like healthcare providers and law enforcement, there was a 72% satisfaction rate. While that could be higher, there are movements encouraging sensitivity training and other learning that could increase the satisfaction of those who go through such traumas. One of the more interesting things about this article is that the importance of improving the interaction between survivor and the personnel meant to help them is highly focused on the trainings and education. Those are stressed as an important way to have these personnel be able to interact more appropriately with the survivors. So this slide talks about the root causes. So mental health issues caused by sexual assault leads to decreased chances that sexual assault survivors will disclose the information to the healthcare provider, leading to decreased access to healthcare. So Bates et al. 2019 discusses the prevalence of mental health in sexual assault survivors. Essentially, survivors of sexual assault are more likely to have mental health issues like depression, anxiety, and PTSD following their traumatic event. These lead to sexual assault survivors to withdraw and not disclose their experience. By not wanting to disclose their experience, or maybe wanting is the bad word, but having difficulty disclosing their experience, they don't access healthcare, which leads to their health disparity. This population is vulnerable to lack of access of healthcare because of the toll on their mental health that the experience has had on them. So Bell et al. 2018 discusses their study that the majority of women with PTSS, so post-traumatic stress symptoms, didn't receive help with their mental health for an average of 6 weeks. So that's a pretty long time to wait for mental health following a traumatic event. And this leads to suppression and lack of desire to seek help from healthcare professionals, eventually leading to the health disparity of lack of access to healthcare. Here's some contributing factors related to Maslow's hierarchy of needs. So the met needs are here. Met needs are breathing, water, food, homeostasis, excretion, friendship, family, creativity, spontaneity, problem solving, lack of prejudice, and acceptance of facts. Unmet are security of body, sex, security of morality, sexual intimacy, self-esteem, confidence, respect of others, and respect by others, and sleep. Anticipated functional level is psychological. So this means, let's see. For likely health outcomes, I imagine it differs from person to person depending on who gets help and who doesn't. But as the slides mentioned above, those who don't get appropriate help in the first few weeks likely turn to depression, anxiety, and substance abuse. And those who get help are able to work with psychologists to begin working on their mental health and their PTSS, PTSD from the event. So those who get help are more likely to have most of their needs met by Maslow's hierarchy of needs, and those who don't get help are more likely to have more of their needs unmet. So here's some specific concerns related to communicable diseases or infections. So survivors of the sexual assault are at higher risk for communicable diseases like STIs. So some of the most common ones are chlamydia, gonorrhea, bacterial vaginosis, and trichomoniasis. So according to Ladd et al. 2021, survivors of sexual assault are more likely to get STIs. Some of these STIs are chlamydia, gonorrhea, bacterial vaginosis, and trichomoniasis. He also explains that the statistic for these are 12% for trichomoniasis, 19% for bacterial vaginosis, 2% for chlamydia, and 4% for gonorrhea. But these statistics are hard to ensure because they vary from population and location, like county, city, state, where some of these are more common than others. So for non-communicable diseases or infections, Ghosh and Verma 2018 discuss that how stress has a role on acquiring diseases. Ghosh and Verma 2018 stated, stress can lead to disease in people with poor adapting nature, which is quite evident, highlighted in this article. It was highlighted how stressors affect both mental health and physical health. This tells us that people who are more stressed than others are poorly able to handle stress in their lives are more likely to acquire diseases. Some of the diseases mentioned were diabetes, cardiovascular issues, and upper respiratory issues. Ghosh and Verma also discussed that traumatic events occur in the lives of 40 to 70% of Americans. And when these traumatic events are not worked through, they can turn into acute stress disorder or post-traumatic stress disorder. They can lead to issues like depression, anxiety, substance abuse, and thinking impairment. Ultimately, we learn that the effects of stress lead to disease that isn't always communicable. Stress can also lead to non-communicable diseases, and that's why there's a great importance on getting help after stressful events like sexual assault. In regards to self-care or self-harm, Cheng et al. Stated that sexual victimization is a unique but important indicator for self-harm. So he discusses the important factors for identifying potential self-harm. His article identifies sexual victimization and loneliness as two very important indicators for self-harm. Their study was based on non-lethal self-harm, which basically means that self-harm is not intended to end in suicide, but still affects the person. There are important factors to be aware of due to the information in this article. Women who have been victims of sexual assault are at higher risk for self-harm. Thus, it would prove obvious that there needs to be psychiatric help given to these women to help cope with the trauma they've gone through. Also, Cheng et al. Mentioned that loneliness is also a contributing unique factor to self-harm. Thus, if a person is both lonely and has had a traumatic experience like sexual assault, they're extremely more likely to engage in self-harm. And risk of harm by others or to others. This one was pretty interesting. Bellis et al. Stated that compared to individuals who experienced no abuse in childhood, those who experienced one form of abuse were over twice as likely to report physical assault in the past year, 3 times as likely to have experienced interpersonal violence and or sexual violence since age 16. So, this shows us that victims of sexual assault are more likely to experience some form of abuse in the future when compared to those who have never experienced sexual abuse. Bellis et al. 2020 also talked about the fact that if a person experiences multiple types of abuse in their childhood, they are significantly So Bellis et al. 2020 also talked about the fact that if a person experiences multiple types of abuse in their childhood, they're far more likely to experience re-victimization in their adulthood. So this is concerning because many people go through the traumatic experiences in their childhood. So what can be done to help prevent the re-victimization of these people? A lengthy but important excerpt from Bellis et al. 2020 states, childhood abuse is not a direct causal factor of violence victimization in adulthood, but rather abuse is likely to disrupt normative development processes like secure attachment to a caregiver, which enables children to regulate behavior and emotions, creates difficulties relating to others and forming healthy relationships, and cause problems in areas like aggression, hyperarousal, and impulse control. These factors may function as adaptive reactions in abusive environments, but conversely may also increase re-victimization. Teaching these victims skills and ways to cope can help prevent issues like this from occurring in the future. And then here are my references.